According to official statistics, 1 million people have now died of coronavirus worldwide, and 32 million people have been infected. This number might be significantly lower than the actual number of deaths and the actual number of cases. New research suggests cases may be as much as 750 million worldwide and more than 2 or 3 million deaths. Even if it is only 1 million people who died of coronavirus, that's still more than died in the most recent year that statistics are available for of malaria, HIV/AIDS, and suicide. And we've got plenty of 2020 still left. Why? Well, that's because of serosurveys. You see, when people become infected, not all of them are going to be tested for coronavirus. And some may not feel the full symptoms in order to even think that they have coronavirus. Of the people who got coronavirus symptoms, only 10 to 30% of the people in the UK who got the symptoms actually went and got tested. The vast majority didn't. The reasons may be that they would have to isolate. And that, coupled with the fact that a lot of young people will have got coronavirus, COVID-19, and got better without even knowing it, means that a lot of people may have actually been infected who did not get tested and didn't become part of the official statistics. So scientists use serosurveys. Serosurveys are where they test blood tests which were given for various reasons like routine blood tests, and they test them for antibodies of coronavirus. And this gives a better idea of how much it's spread across the population. Are serosurveys accurate? Well, on one hand, some people will fight off the virus without producing any antibodies, especially young people. So those people won't even show the antibodies. So that will show from the actual number, it will show less people were infected when actually more were infected. Similarly, sometimes serosurveys pick up antibodies for other viruses. So that will show the number to be slightly higher than the actual number of coronavirus cases. And the fact that low levels of infections won't get picked up by the serosurveys means that the number will be lower. All of this, coupled with the fact that not much information is available from China, who have been accused of a cover-up, mean that this might even be lower than the actual number of people who have contracted the virus. The World Health Organization's serosurveys results came back to suggest that 10% of the world's population have had coronavirus, with 90% of the world still at risk. One serosurvey from last month combined data from 279 serosurveys across 19 countries. That serosurvey showed that by the end of January, the world was already at 1 million cases per day, and by May, it was 5 million cases worldwide per day. That particular serosurvey suggested that infections may be around about 500 to 750 million people. The serosurveys show us that actually in Germany, infections were 4.5 times higher than the official number. In Minnesota in the United States, it was up by a multiplier of 7. In the United Kingdom, it was up by a multiplier of 12, and in India, it was up by a multiplier of 44. From the outset, it appears that richer countries are dealing with the COVID-19 virus a lot worse than poorer countries. There's less testing of people who die to see whether they actually died of coronavirus. The other reasons, like in advanced Arab countries where they do have a lot of testing, is that they have less of an aging population. In Europe, 21% of people are over 65, whereas in sub-Saharan Africa and many Arabian countries, only 3% of the population is above 65. Now, David Spiegelhalter from Cambridge University calculated the risk of dying from COVID depending on age, and he found that for every year of age, there's an increase of 13% risk of dying from coronavirus, which means that a 65-year-old has 100 times more chance of dying of coronavirus than a 25-year-old. Some people may suggest that coronavirus is not so deadly because if not many people are dying from it, but lots of people are infected, then this means it's not so deadly. However, the official number of people who have died from coronavirus is significantly lower than the actual number of people who have died. There's a few reasons for this. For example, in poorer countries, there's less testing of people who die to see whether they actually died of coronavirus, meaning that the official number of deaths is lower than the actual number of deaths. Secondly, it's now been found that the virus was actually going around the world as early as November, with many people being infected without even knowing it. Now, those people who were dying before February, March, when testing became widespread, would have been put down as dying of something else other than coronavirus. That also means that the official number of deaths will be lower. Thirdly, scientists have looked at the number of excess deaths in the months of 2020 compared to the months of previous years. And what they've found is that there has been excess death. Now, these figures might also be too low. Because, for example, when there was a lockdown, there would be less road collisions and less death from road accidents. It's been found that people began taking care of their health more when they found out about the virus, bringing their BMI down and taking their medication correctly and taking more healthy steps. Despite this, if you look at the number of people who died in March in previous years compared to 2020 in the United States and Europe, as well as Latin America and Russia and South Africa, what you find is that 580,000 people died in previous years in March. However, this year, 900,000 people died. That means an increase of at least 55%. Because remember, less people are dying of road collisions, people are taking more care of their health, bringing their BMI down and taking their medication more correctly. So the number is likely to be even higher than that. But if we go based on that, COVID deaths are going to be at least 55% more than the official stated figure. That means that in the United States, the official figure is only 30% of the real number of people who have died of COVID, meaning that 300,000 people have died of coronavirus in the United States. That's 10% of people who have died. And that's half of the number of people who die of cancer. And we've got plenty of 2020 still to go. So the official figure of passing 1 million deaths is quite low. The actual number is more likely to be 2 or even 3 million or more. Until a proper audit is done in the future, we won't actually know the scale of the number of people who died. In the UK, if somebody dies after spending a month in hospital, as many serious cases do, then they will not become part of the statistics of COVID deaths because there's a limit of 28 days on there. This shows the numbers lower than they actually are. And whether the numbers are 1, 2 or 3 million or even more than that, this is after lockdown, after social distancing, with so many steps being put in place to make sure that we keep away from each other and that the virus does not catch on. After so much precautions, we end up in a situation with so many deaths. Imagine if none of these steps were taken. The number of dead would have been significantly higher. So what's the solution? The solution, of course, has always been to keep the R number down. The R number is the number of people who become infected from an existing infected person. So it naturally follows that an infected person should stay away from non-infected people, which is why they isolate. Governments introduced lockdowns to make sure that the health systems of the world didn't collapse under the weight of the pandemic. These were successful in preventing that. For example, if we look at countries that didn't lock down, like Sweden, then there were 58 deaths per 100,000. But their neighbouring countries who did lock down, such as Norway, who had 5 deaths, Finland, who had 6 deaths, and Denmark, who had 11 deaths per 100,000, we find a massive disparity between the two. And the reasons for not locking down have often been that they don't want their economy to take a hit. Yet the GDP and economy of Sweden has fallen almost exactly the same as any other country. No doubt that lockdowns are not a permanent solution, but social distancing, hygiene measures, and masks and visors will help reduce transmission of the virus. Governments have also introduced test and trace systems, and they've largely been successful in countries such as Canada, Germany, Italy, China, Japan, Singapore, and Taiwan. Concerns have been raised about the amount of data that a government should be able to track and trace, as well as how much they should be allowed to store without infringing on people's rights. What's also been found to be effective with government measures is shutting down large events. In Israel, where they had an early lockdown and brought cases down, due to political pressure from the religious right wing, they ended up ending the lockdown early and allowing synagogue ceremonies, Torah ceremonies, large weddings, and all of these things, when they were allowed, took the number of cases and the number of deaths up. Super spreader events have been found to be a contributory factor to spreading coronavirus, such as an event in Boston which led to 20,000 cases. Shutting down large gatherings clearly has an effect on bringing the number of cases and transmission down. Some governments have proposed 2 steps which I believe are quite inhumane. The first being harvesting, that the people most likely to die early on, reducing the number of deaths later. I don't know what kind of people propose that kind of thing. The second is herd immunity, which is kind of inhumane as well, because you're experimenting with something that is unknown. Herd immunity is the idea that when a virus has gone around enough of a population, it would reduces the transmission of the virus between infected people and the people who are susceptible to die from the virus, because then there's enough immune people in between. But what we're finding in Brazil is the complete opposite, where herd immunity was achieved, yet coronavirus cases are spiking and deaths are going up as well. Lockdown ended up providing 3 advantages to fight this illness. The first was understanding the illness better. Doctors now have a much better understanding of how to treat patients with coronavirus than they did 6 months ago. One study shows a survival rate of only 66% in March, and in August shows a survival rate of 84%. The biggest gains in survival rate have actually been found in the elderly, where only 39% chance of survival was achieved in March, whereas in August it was 58%. Secondly, lockdowns enabled track and trace systems. And thirdly, lockdowns gave time to develop a vaccine. We may only be a few months away from developing a vaccine. Now, vaccinating earlier definitely means that the R number will come down significantly more than vaccinating later. If you see this graphic, it shows if we vaccinate in December, what will happen, and what will happen if we vaccinate in June 2021. However, that vaccine, of course, needs to be an effective vaccine. China and Russia already have a vaccine, but there's been concerns over its efficacy and lack of efficacy testing. Concerns have been raised around vaccines, and they go from the sensible to the complete ludicrous. For example, some people have been concerned that government officials have a conflict of interest in big pharma companies. Others have been concerned that big pharma may be putting profit before efficacy. And some have gone on to share conspiracy theories that the vaccine is actually going to be used to somehow depopulate the world. All of these concerns will likely factor into how effectively the vaccine is taken up in the population. Perhaps if scientists can provide enough data of efficacy testing and trial data, hopefully these concerns can be allayed. Since we're on the topic of conspiracy theories, some people are suggesting that the second wave is not so bad. But what they're not remembering is that, as I mentioned earlier, the virus has been going around the world since November, and nobody was testing for coronavirus COVID-19 in November, or December, or January, or even February in many cases. Testing started on a large scale in March, so all the people who had been infected or died before that point were not forming part of the statistics. Even when testing started in March, testing was not being done on such a large scale as is being done now. So those people who are comparing 2 graphs, one showing the number of coronavirus cases going significantly higher with deaths being very low, saying, look, the concerns have gone, people are not dying of coronavirus. This is incorrect, because if you had been testing since November, you would find the number of infections are significantly higher than the number of deaths. Deaths usually take a little bit of time to catch up with the number of cases. That's the 101 of how logarithms work. Things take their time to get going. Unfortunately, these theories are really making their rounds, partly because people are becoming more fed up with measures that are put in place. 6 months ago, people were more accepting of lockdown measures, social distancing measures, but now people are becoming more fed up with that. This, unfortunately, is seeing a rise in coronavirus cases, and with winter around the corner, it may see a massive spike in cases and deaths. This is shown by the fact that infection rates are growing in younger people. Now, while younger people are less at risk of dying from coronavirus, as we mentioned earlier, they don't live in the bubbles that they think that they live in. Ultimately, they will come into contact and pass on the illness to somebody who is susceptible to die from coronavirus, such as the elderly, the people who are immunocompromised or have underlying health conditions. And it's quite a selfish way of thinking about it, really, that, yeah, okay, I might be fine, therefore I'm just going to be complacent, but your grandma could die from it, or your close friends. Going forward, we need to move forward together. Now, there may be some concerns people have of the government using coronavirus to bring in some draconian laws. And if that is the case, then everybody needs to band together and make sure that that doesn't happen. But coupling legitimate concerns with conspiracy theories is helping no one. One conspiracy theory going around is that doctors are somehow incentivized to write on the death certificate that the person died from coronavirus. This is simply untrue. If you've seen anything, you will find that doctors and nurses are vocally outspoken against steps that the government take and have taken in the past. And there's no possibility of such a large number of doctors being in cahoots with the government. I mean, think about it logically. Anybody who becomes a doctor or a nurse generally is doing so for altruistic reasons. Why would they then become part of a massive conspiracy to just fill in forms saying that people are dying of coronavirus when they are not? And people are suggesting that somehow they are incentivized to do this. Why would they be incentivized to do that? Where's the evidence for that? Another theory is even worse, where voice messages and other things are going around from people who are saying that doctors are purposely killing off people to inflate the numbers. Again, why would they do such a thing? Spreading these conspiracy theories has meant that some people have become anxious of getting treated in time. And these people may die at home, and if they don't, then they may go in to seek help a lot later. Early intervention is a factor in getting better with any illness. One conspiracy theory going around is that wearing a mask will reduce oxygen levels, making you hypoxic and making you susceptible to any virus. That's again completely unfounded. Just think about it on a logical level. If that was the case, then surgeons and nurses who wear masks all day would be constantly hypoxic and have low oxygen levels and become infected with whatever virus was going around at the time. This isn't the case. Then think of A&E doctors who are on the front line taking in people who are infected or who have problems, and they wear a mask all day. Surely if their oxygen levels went so far down that they became hypoxic and susceptible to infections, then we would have seen this happen for decades. You also find builders and other people who wear face coverings all day. They don't find that their oxygen levels go down or that they become hypoxic or susceptible to infections. There's also those people who are claiming that COVID-19 is completely fake. It's completely made up by governments all around the world, and they somehow got all of them got together despite their political differences and decided that we're going to invent this virus, and for whatever reason they would do that. Now, that kind of conspiracy theory means people become complacent. We've seen time and time again people who were complacent with this virus ended up becoming infected with the virus, with many of them ending up dying from the virus as well. Some people in the United States wanted to test this theory because they believed that the government was lying about this. So they had a COVID party where an infected person who was positive with the virus went on to purposely infect lots of other people who voluntarily became infected with the virus. One of the people at the party then died as a result of that and regretted it moments before he died. When all of the medical doctors of the world and nurses and scientists are all in agreement that there is a virus called coronavirus, COVID-19, and that it is killing people, and that we need to take these measures, then to claim something against that would be silly of us. Imagine if you went to the mechanic and the mechanic said that your car is about to break down, and then you got it checked by a second and a third and a fourth and a fifth and a sixth mechanic, and all the mechanics in the world are in agreement that your car is about to break down. If you drive that and you are complacent, you will end up losing your car. Your life is more important than that car. We need to get together and stay safe and make sure that we protect those who are vulnerable within society, whether we are susceptible to dying from the virus or not. Thank you for listening. And remember, you can now download Muslim World Journal as an app on your phone. Finally, stay safe and take care of those around you.